treating just over 2,000 patients for COVID-19. That's down a bit. It was well over 2,100 just yesterday. But here's the caveat. The local numbers don't look quite as good. More than 700 people are hospitalized in North Texas, which is a new record. Tarrant County has 225 new cases. Dallas County, 312. It's pretty clear some of these numbers may not be going in the right direction. The city of Dallas's health czar says public health experts think the city has not reached its peak. Dr. Kelvin Baggett joins us now to help put some of these numbers into context. Dr. Baggett, thank you for joining us. I'm wondering, have we reached a point where hospitalization is a much better indicator than simply counting the number of cases?
Well, Chris, first of all, thank you for having me. And so I'd say that we can't look at any metric in isolation. So it's important that we consider the number of new cases, as well as the number of hospitalizations and the number of hospitalized patients that are being admitted to the intensive care units. And so we're looking at those along with some other key metrics, but I think you want to look at those in collaboration.
I just want to, Wayne County, which encompasses the city of Detroit, they have over 2,500 deaths from COVID-19. Orleans Parish, which encompasses obviously New Orleans, they have nearly 3,000 deaths. Here in Dallas County, we have 277. I mean, is it safe to say it is okay to reopen and gather? We simply are not being affected by COVID-19 in the way some other urban areas are.
Well, I think the reason we're seeing some of those numbers is because we took aggressive steps and measures early on in terms of staying at home and sheltering in place. What I continue to advocate for is that we are selective when we're going out, when we do venture out, that we're also using the personal protections that we know are also helpful. So I think it's far too early for us to say we can relax and not engage in some of those precautions and continue to advocate for us adhering to them for everyone's safety.
Okay, in terms of wearing a mask then, some of these precautions, I think it was the World Health Organization said, well, now it looks like asymptomatic people aren't really transmitting this disease. So why is it so important to wear a mask if a person is perfectly healthy?
Chris, thank you for that, because I think that what also happened within a 24-hour period is the World Health Organization began to change some of their comments regarding the spread by asymptomatic patients and individuals. And so what they arrived at was that there is still spread, and what we know is that the most vulnerable amongst us could be the greatest impacted in terms of suffering and death. So they came back, reissued a statement, and the public health experts that I've engaged and that I continue to hear from are continue to advocate for these protections because, again, we've seen them to be effective and to be implementable as well in most circumstances.
All right, Dr. Baggett, I'm afraid we're out of time, but I thank you very much for taking our questions and for putting some things in context. Thank you very much.
Thank you very much.